And so I worked on this client in excess of an hour, and she now dorsiflexes to at least 5 degrees, and the subtalar joint is a lot freer. I can spring up through the tibia, and there's force transmission through the body, and mid-tibia. She walked and she felt like her knees were flexing more readily, is that correct?
Yes.
Okay. And the pelvis has, you know, much improved force transmission, and then just a little bit of lateral give. It has good force transmission. I know that I didn't show in the other video how compressed your upper cervical was, but if you would just point the camera to her feet. And so what I'm doing is tractioning the OA joint, and so readily, such a minimal force, and it translates all the way down. Let's have you on your stomach. And you have to travel an hour and a half and be somewhere at 1, is that correct?
Yes, at 1:30.
Okay, so we're speeding it on. See how that force goes through there? And on the sacrum, it just doesn't feel as prominent. It could certainly be a soft tissue phenomenon driven neurally and so on, but it's a little tight here, but at least I can induce some force. So we'll pay attention to the tightness there. And I can see the force transmission all the way through her feet with this. I can take up the slack to where there's a stop, and then I spring quickly with the same amount of force, and there's force transmission through that. So now I'll show you along the spinal axis. So I can get force transmission through the center, through the T-spine, and then through the rib cage as well. Okay, and I'll take over filming, and then would you come and walk in the hallway, please? And then can you roll your pant legs up and then come back? Looks to me like you have a little bit more dorsiflexion. Do you feel like you do?
I do.
Tell me what your gait feels like, please.
It feels much softer. I know I'm flexing everything a lot more than I did before because everything was so rigid earlier. And there's a kind of a nicer flow to it.
So it feels fluid?
Yes.
Okay, alrighty. And how do you feel in general, ignoring gait, how do you feel in general?
In general, I feel okay, except for still with extension on the right side.
That still
with
produces
hip extension, pain. There is some pain,
yeah.
Yes.
So turn around and just point to the area that you still feel pain. Okay? So when you extend your hip during gait, like right now,
it hurts right here.
That starts to hurt.
It feels like something is jammed in there.
Okay? So we'll stop here. I don't see large changes in your gait, but by description, I like it. I would say that I'm still surprised that you still have some rigidity in the T-spine and rib cage. And I thought that I would gain more than 5 degrees of dorsiflexion, because looking at your body type, your body structure, your youth, all that stuff, I would have expected more movement there. But this is just day 1.
Okay.
And so you come back tomorrow and we'll be able to see what patterns stayed improved, and maybe some other things will evolve that are right now occulted, because we did do a large input into your nervous system. And I've seen this where on day 1, they seem to have a lot of mobility throughout, but then on day 2, a couple of areas announce themselves. And I always say you can fool Mother Nature 24 hours, but not more than 24 hours. So we'll stop here.
Okay.
And was there any reduction in pain? Like, how much pain did you feel when you came in?
Well, it's not necessarily a constant pain, but with certain things, there is less pain for sure. I feel like my hips are actually rotating a little bit more, and going into hip extension a little bit more is what I feel. I don't know what it looks like, but there is some soreness in there, and I would say, I'm guessing L5, L4 were really tender to touch when you were on camera, kind of showing the spring.
Right,
They were very tender.
Okay.
And then you did this
Spring on the ilium.
spring on the, yeah.
Yes.
And that area just hurts.
That's
to
consistent
touch.
with what your history says. And the fact that they did an x-ray right at the 12th rib, because that quadratus comes off 12th rib and other structures. But so that certainly, requires a deeper look. But to summarize really quickly, I worked on your ankles, your subtalar joint. I worked on the hips to gain extension and rotation, and then treated the pelvis, and then went up and treated the upper cervical spine, specifically the C1, and then after that specifically the occiput, restoring posterior glide and flexion and traction. And then we worked on first rib on both sides, and then we worked on your AC joints, and inferior glide of the scapula was worked on. But I distinctly get the sense there's more to be improved upon.
Okay.
And I want that rib cage to be a little bit freer than what I see today. So tomorrow will be a very good day. Okay. We'll just continue this detective work, okay? But I'm happy to see that the softening did occur where it did. And I'll stop now. Thank you.
Thank you.